Hi everyone, welcome to NATCO Studio Room, and I am being with Dr. Kishore from Medanta Hospital, Panna. So welcome to NATCO Studio Room, and it was a really pleasure to meet you and talk to you. So I have some questions to ask you, and I would like to know all the insightful thoughts of yours. So can I ask?
Yeah, sure.
Okay. So what are the latest advancements in the treatment of NDM producing infection?
The latest, the NDM, as we know that because of now we have more doing multiplex tests, so we are aware about we are working on the genotype, and the NDM is the notorious since long, and the bad name attached with our country also, like New Delhi beta-lactamase. And the current practice is that if the NDM is there, we are also looking for the organisms. If we are hitting with the like Acinetobacter, so we have option to go with the, although we know the carbapenem is not working, so we have the option like polymyxin B and the polymyxin E kind of things. Another, we have also looking for the OXA48 and other than the NDM is there, then we are going for with the ceftazidime avibactam. Although because in our country we don't have availability of verobactam frequently, at least in my state is not available. Somewhere in Delhi people are importing from the west, but still we have the limitation. Other than the carbapenem, we have the polymyxin and we have the ceftazidime avibactam, and with the combination of azithromycin.
All right. Can I ask the next question?
Sure. Yes.
All right. So what are the best practices for preventing the fungal infections in the bone marrow transplant patients?
Bone marrow transplant patient, when we are thinking about that depends upon infections. Actually, that depends the practices where what kind of fungal element people are going. If we are going with the broader spectrum, we have the amphotericin B. We are going with the liposomal amphotericin B. Other than that, depends if the patient is having some renal component, going with the capsophagen or any kinocandins we are using. So it depends the center, what prevalent fungal infections are there. Accordingly, we can opt the antifungal.
All right, thank you. And the next one is, how effective is ceftazidime avibactam in treating complicated urinary tract infections in the Indian setup?
The Indian setup, like the ceftazidime avibactam, is one option. The reason we had so many of the pyelonephritis, still we are getting the E. coli and all. But if it is the complicated UTI having the Klebsiella, so definitely ceftazidime avibactam is a good option in a complicated UTI. But we are worried about the resistant pattern, because we know this ceftazidime avibactam and azithromycin is a drug we are using on a very MDRO kind of condition, when we have no any other option, when the carbapenem is not working. Still in our setup, what we are the microbiological feedback is there in a complicated UTI. Still we have a drug working, the carbapenem is working. But definitely, because we just want to save this drug, if they have the particularly lung infections and the Klebsiella infection there, when we are not going to add any kind of polymyxins, that time ceftazidime avibactam with azithromycin is a good option. But keeping for the UTI, until it's very complicated UTI and we are getting the resistance, then only we'll use this your ceftazidime avibactam.
All right, thank you. Thank you so much, sir, for sharing your insightful thought with all of us, and we are so happy for that. And ladies and gentlemen, we are going to conclude the NATCO Studio Room with Dr. Kishore, sir. Sir, once again, thank you so much for coming here.
Thank you.